Hello guys, today we are discussing about CO11 denial in medical billing. It telling about diagnosis code and a procedure code mismatch together. Before discussing this denial, first of all, thank you so much for your time to spending here to learn something new today. And guys, if you are watching our video first time and if you're not yet subscribed, could you please subscribe our channel PKR Vibes Career and Growth and hit the bell icon so that you will get every our video as a notifications to you. Okay guys, now we are discussing about pre-call analysis for CO11 denial. Before that, we have to understand that what is pre-call analysis. Nothing but before calling to insurance, you should have to understand what happening on a claim, whatever you submitted. So did we receive any response back from the insurance company? So in that way, you should have to analyze on your medical claim which is already submitted from your end to insurance. So that will be required before calling to insurance. That is nothing but pre-call analysis. Nothing but by name we can understand that before calling to insurance we should have to do a basic analysis on a claim. That is called as a pre-call analysis. For CO11 denial, it's telling about the diagnosis code and a procedure code is mismatched together. So at the time, what kind of pre-call analysis required is first point is if not received any status from the insurance, then check all internal sources like practice management system, like nothing but your doctor's software, and clearing houses, nothing but your doctor's internal clearing house. Nothing but electronic claims are submitted through this entity or software clearing house. And also if you have access for portal, insurance portal, could you please check for portal for the claim status. So for example, you submitted claim to insurance and you are verified software and you confirm that there is no response or there is no EOB available for the claim. At the time you should have to check the clearing house. For example, claim is submitted through electronically. At the time you should have to submit, I mean you should have to check your clearing house for the claim status. And if you doesn't find any information about the claim in your doctor software as well as a clearing houses, then if you have access, could you please check the insurance portals for a claim status. So unfortunately, if you doesn't found any information about the claim for the in doctor office, clearinghouse or portal, then you should have to call to insurance. So before these steps, before calling, are known as a pre-call analysis for the CO11 denial. And also next step, for example, if already are denied EOB posted in PMS with the code CO11. For example, you are checking doctor software and you found that EOB is received from the insurance and it is already posted in our software with the denial code CO11. Then you need to verify the previous DOS payment history. For example, what happened, in previously we build this kind of procedure and diagnosis code to the insurance. If already previously we build a medical claims with the same services and we got the payments, at the time you should have to analyze that information before calling to insurance. For example, previously we got a payments for similar kind of services, then as a AR caller your job is to call to insurance and telling that we got payments and previously or in future does also, so we got on other data services for the same kind of services payments from your insurance. So now also we want payments, so that's what I'm calling. So with this information, could you please reprocess the claim? In that way you should have to use pre-call analysis before calling to insurance. Okay guys, now we are discussing about on-call steps. So if you are calling to insurance over the phone call, what kind of information you should have to verify and what kind of questions you need to ask to insurance representative over the phone call, we will discuss for CO11 denial now. The first question, for example, you are checking in your PMS, in your clearing houses and in your portal and got to know that you are nothing information you found or there is no claim details you found. At that time you should have to call to insurance. You should have to talk like this: hi, this is Thomas, I am calling from provider's office checking on a claim status. So may I know the claim status, please? If you are asking this question, the insurance representative will ask you about the uh, you know doctor's provider details and also claim details. Provider details nothing but they will verify the provider details: what is NPI, what is taxonomy code, what is your office name, and also they will ask about the claim details later: what is the claim number, or what is, I mean, sorry, if there is no claim number you found now from your side, they will ask what is the claim billed amount, what is the claim date of services. If you are giving that information, they will get that information from their system and they will tell the details about the claim. So you have to understand that, for example, UOB is not available at the time, you should have to ask the question, may I know the claim status, please? For example, second point is, may I know the denied clarification. For example, you are verified in our PMS or clearinghouses or portal, whatever it is, you got to know that, for example, EOB was posted in our PMS with the denial code CO11. Nothing but you have a claim number with you. So at the time directly you are telling that, may I know the denied clarification, please? At the time, insurance representative will verify the provider details like NPI, taxonomy, and provider name. Later they will ask the directly claim number because you have a claim number, right? And also sometimes they will ask the what is the date of services and what are the billed amount or claim number. If you are providing directly, they will look for the denied thing, why it was denied. So at the time, the insurance representative over the phone call will tell that diagnosis code and whatever the procedure code you build are inconsistent to each other or mismatched to each other, or nothing but do not match. The diagnose and CPT are not match. Nothing but whatever the symptoms of that particular patient and whatever the treatment given by the doctor is not similar to each other. So that is the denied code reason. For example, as we discussed as a pre-call analysis, if we previous DOS or future DOS, we got the payments for the similar kind of services from the similar insurance, I mean from the same insurance. At the time, you should have to ask the over the phone call like this: could you please send claim back for reprocess? Because on previous date of particular so and so date of services, we got a payments for the similar services. At the time, insurance representative tell you that, could you please hold, I will verify. So they put you on hold and they will verify whether on previous does they send you nothing but provider, send to provider the payments or not. If they found yes on previous does for the same services, they send the payments to the doctor. At the time, for this claim also they will send the claim back for reprocessing. If your analysis is correct and if the previous dose is billed and paid for the same kind of CPTs, they will verify and they will send the claim back for reprocess. So you have to telling this point over the phone call, like we got a previous DOS payments for the same services. Could you please reprocess the claim? You should have to mention this point. At the time only they will reprocess max. And at the time, if the claim sent back for reprocess, you should have to verify what is the ticket number for that or what is the reference number for the reprocessed. So they will give the reference provider number, reference number for the reprocessed one, like 4-digit number or some other number they will provide. After that, you should have to verify what is the reprocessed turnaround time. Like some people will take, some insurances will take 30 to 45 days, some insurances just 15 days. Like that, you should have to verify what is the reprocessed turnaround time. So you have to understand that whenever claim sent back for reprocess, you should have to verify what is the reprocessed ticket number or reference number and also what is the reprocessed turnaround time. These two things you should have to take, and you should have to take the call reference number if you have a claim number with you, then close the call. For example, there is no previous DOS or future DOS for the same kind of services. At the time, you should have to verify, may know the corrected claim timely filing limit and a corrected claim mailing address. So, and also in addition to that, could you please take also, may I know the appeals timely filing limit and appeals mailing address. Why I mentioning this point means, for example, the denial is standing like a diagnosis code is not matching to CPT, and there are a no previous dose history. At the time, what is the root cause? What is the final thing you will go? Might be you should have to uh, change the CPT or diagnosis code, because if you are asking over the phone call, like, may I know the diagnosis is inconsistent or CPT inconsistent, the insurance representative will not give you should have to change the diagnosis or you should have to change the CPT. They will tell that you should have to you should have to consult, as you should have to reach out to medical coder, because medical coder will change the diagnosis or CPT code accordingly. So at the time, for example, DX and CPT are inconsistent. At the time, medical coder will review that thing accordingly as per medical records. They will change the diagnosis or CPT code accordingly. So at the time we should have to submit corrected claim. For example, diagnosis is, if the coder is changed the diagnosis code later, at the time we should have to submit a corrected claim to insurance. So that's what we should have to verify on call itself. May know the corrected claim timely filing and appeals, also appeals timely filing, like that corrected claim mailing address and appeals mailing address. So always note that normal claim submission timely filing, appeals timely filing, and corrected claim timely filing are different. And also, appeals mailing address, normal claim submission mailing address, and corrected claim mailing address also sometimes different. So we have to understand and note that point. So finally, you should have to, for example, UOB is not available. If you are calling for claim status for the insurance, you should have to ask like that, may I know the claim number and call reference number, you can close the claim. For example, you know the denied EOB in a PMS, you know the claim number, like, so at the time you should have to ask the call reference number and close the claim. So these are the main steps for a CO11 denial. These are the main questions you need to verify over the phone call. Okay guys, now we are discussing about end actions on CO11 denial in medical billing. So first point I given first end action is reprocess the claim. See, for example, on, as we discussed as a pre-call analysis and on-call analysis, if we got to know that previous DOS already got the payments for the similar kind of services, then as a AR caller, you should have to do a pre-call analysis, and on-call analysis, you should have to probe this information over the phone call. Like, we got to know that on previous DOS or on future DOS also, mostly on previous DOS, we build a similar kind of CPT and diagnosis code, and also we got the payments to the doctors. Could you please reprocess the claim with reference to that previous DOS claim? If insurance representative verified and agreed with your point, they will send claim back for reprocess. So this is a very important action on a CO11 denial. So really it is a very good job, because if you are good at analysis, and if you really got a payments for the similar kind of services on previous DOS, associate proved that information over the phone call, then insurance representative will reprocess the claim. This is the one end action on your CO11 denial. Sometimes second end action we will talk about. Sometimes what happened on previous DOS, we don't have any this kind of CPTs build, or there are no other previous or future DOS claims are built for the patient. This is only the first time we build, and got to know that diagnosis code and procedure code are inconsistent or does not match, and you are verified over the phone call, and the insurance representative told that we are not able to say that diagnosis or CPT which one is need to correct. At the time they will suggest you that as a insurance representative, they will tell that you can get assistance from your coding team or internal coding department. So at the time you should have to verify corrected claims timely filing and mailing address. With that information you should have to task your medical claim to coding assistance. So what happen, for example, if you are tasking to coding assistance, that is as a AR caller, your job is to task that kind of claim to coding assistance. Just knowledge purpose I am telling. For example, if you are tasking to coding team will review that information For example, if you felt that they would like to make some little changes as per medical records or as per medical necessity, they will change the diagnosis or CPT code accordingly. So if they are changing that information, we have to submit that claim later. Once we receive a coding response, we should have to submit the corrected claim along with the resubmission code 7, along with original claim number. We have to submit the claim again to the same insurance like a corrected claim, so that we can make changes like CPT or diagnosis accordingly. So at the time, there is a time limit. Within the time frame, we have to submit the corrected claim. So in that way, the coding team will review and make the necessary modifications accordingly. We have to understand that point. And the third point is, for example, there is no previous DOS, so the insurance representative not reprocess the claim. And you, for example, you tasking to coding and coder telling that whatever we build the diagnosis and CPT are coded correctly only initially. So coding team telling that whatever we did and whatever we submitted initially, that is only the correct and there are no modifications required. So in that case, there are a first point and second point both are not tally, are not correct. So they will not reprocess and there are no coding changes are necessary for this claim. Then what is the final action? Then obviously we can call to insurance. We will tell that we are discussed with our internal coding department, there are no changes are required, could you please reprocess? They will tell that no, we are telling that we the diagnosis and CPT are inconsistent. So at the time, we can go for appeal the claim with the medical records. So appeal is nothing but it is a final action on a medical claim. We are telling that we are correct from our end as per our medical records and as per our uh, patient or treatment history, we are correct. So at the time, how can you appeal? You should have to appeal along with your denied you along with your medical records. We are telling that whatever we build CPT and diagnosis code as per the provider service and as per the patient service, whatever taken from the doctor, both are correct, are valid. So you should have to appeal the claim, medical claim, along with the medical records to the insurance company to get to do the review and to give the payments on a appeal. So the final action on a claim, we should have to appeal along with the medical records. That is the end action of a CO11. So like that, we should have to take appropriate actions on CO11 denial. That are the points like reprocessing or coding or appeal. So we should have to take corrective actions accordingly on a CO11 denial. Guys, if you felt content is useful, could you please like our video so that it will reach us many more needy people who are looking this kind of content. Again, thank you so much for your time. Have a good health. Bye for now.